Okay.
And just a reminder, because I'm seeing hands go up, we're not enabling the hand raising for at least the first portion of our program tonight. So if you're raising your hand, I am lowering your hand. Please go ahead and put all of your notes into the, all of your questions and comments into the chat, please, and thank you.
Okay. And the link is at the top of the chat, so you may have to scroll up depending on how big your chat screen is. Okay, so what we're going to be talking about tonight is really just kind of sharing the community experience about what we're all going through with COVID-19, sharing some resources. We've got 4 people presenting their experiences of community working together. We're going to talk a little bit about how to stay healthy, both not just physically, but also mentally and emotionally. We'll have a short period of that. And then one of the things that I think we all are interested in, because we're a disaster prep group, is what happens, since this is obviously going to be going on for a while, if another kind of large-scale emergency happens. And that could range from a power outage, planned or otherwise, a wildfire, an earthquake, any number of things. And we'll be hearing from a number of people about possible ways that we can respond to that. So that's the agenda. Again, my name is Dave Peaty with the Berkeley Disaster Prep Neighborhood Network. I'm going to try to be adding notes here as we go on, so that you folks won't have to take too many notes, and we'll see how that goes. Let's see. Okay. You may also hear from another board member of ours. Her name is Dawn. She is a mom of a newborn, so she's taking care of her daughter first, and then she'll be joining us in a little while. So we're allotting about 40 minutes. I'm hoping it'll be closer to 30 minutes for sort of a sharing of community experience and resources. And we're going to start, if we can, I'm going to try to unmute Helen, if I can find Helen. It's an awfully big group. Berkeley Mutual Aid is a group of ordinary Berkeley residents who got together to try to build an infrastructure that allowed neighbors to help neighbors. And so let me see if I can find Helen.
Here, I got her. Helen Marks.
Yes, thank you.
Got it.
I forgot that I'm not hosting. And I've had the privilege of working with Helen and a couple of other folks on this Berkeley Mutual Aid network, and I'll let her take it from here. And I will try to, I'm going to continue sharing my screen, and I'll go to the actual website that's been constructed. And Helen, if you have a specific place that you want me to go, feel free to just speak up, and I'll try to do that.
Great. Thank you so much, Dave, and thanks for inviting us to talk. I'm very excited to hear about all the other groups doing great work as well. I'll start by just saying a very brief bit about me. My name is Helen Marks. I am a Berkeley native, born and raised, and I have been involved in CERT up in the Kensington area lightly, and then also do crisis response in my day job. I am the mother of a newborn who you may hear cooing in the background, for which I will try to speak more loudly. And I was on mat leave when the shelter in place went into effect, and was trying to figure out how to be involved and kind of not go crazy sitting on the couch reading all the news articles that were coming up. And one of our now committee members made a post on Nextdoor asking if anyone needed help, and I responded, and now the head of our operations for Berkeley Mutual Aid Network. We did not exist before coronavirus. We were a response to try to flatten the curve and support our community, and it's been a pretty incredible response since then. We have been mistaken for the city of Berkeley. We've been mistaken as Gavin Newsom's grocery program. We are not government officials. We're not medical professionals. We really describe ourselves as neighbors. We do have therapists and social workers who are trained, who actually are part of our work, but we focus on being neighbors and using our skills to really support and build community. We focus on two types of need. Two types of people. So one is people who are immunocompromised, so kind of the initial, people who are stuck at home but still need groceries and errands and that kind of thing. And then we've also expanded to focus on people who are having a particularly heavy impact on their lives from coronavirus. So that could be due to the economic situation, due to the isolation. We now have a network of over 1,100 neighbors, and that's primarily in Berkeley, but also includes El Cerrito, Albany, Emeryville, Oakland, Kensington, and I think, and a few outliers, but that's the bulk of where we have coverage. We have prioritized ongoing matches. So as opposed to kind of one-off requests, we really tried to build relationships. And so we focus on delivering 4 types of need. So the first was people who need help with groceries because they're immunocompromised, and it's kind of helps flatten the curve if the fewer runs there. So we do groceries and errands. The second is we really notice that all of us are feeling isolated. And so one of the things we offer is virtual check-ins. So that's a buddy who can call and talk, have a phone call with you, or do a Zoom if you're not Zoomed out. So that's kind of just community support. The third we offer is social assistance. So we've kind of seen an uptick in ask for help navigating unemployment claims or how to get food assistance, those kind of requests. So we offer kind of neighborly social work help. And then the fourth is really direct asks for financial support. We do not generally provide financial support. We help connect people with programs that might be able to offer that, but we do offer stopgap funding if someone is not currently able to afford groceries and is running out of food. And then we also connect them with food assistance programs. So those are kind of the 4 types of help. It's errands, social connection, social work help, and then financial assistance if needed. We have made over 280 teams. So that's someone who asks for help and someone who is helping that person with that need. And that is ongoing support. We ask for them to have weekly check-ins with each other to see if any of the needs have changed, make sure everyone's kind of getting what they need. And we really, as much as obviously there's someone making a request and someone fulfilling that request, we really try to emphasize that it is mutual. And we've just noticed how much this really is about bringing people together, because it's like my same feeling of being on the couch and wanting to help. Almost all of our volunteers have that feeling of wanting a way to engage. And so although they're technically the volunteer, there's a ton of benefit from getting to help, as well as the benefit of getting the assistance that you need. And that's been pretty incredible to see the gratitude on both sides. The other thing I'll mention is that because we have this kind of outpouring of interest in helping, we have expanded from matching buddy to also reach out to other groups and understand where are there needs in the community that we could potentially deploy volunteers to. So one example is we connected with Meals on Wheels, and they were having a shortage of non-perishable goods and toilet paper. And so we did a call to action to our network to say, hey, can you help? Let's get this done. And there's been a huge response to that, which is incredible. So that brings me to what would we ask of this group if someone is interested in helping? The first is, if you want to volunteer, you can see on this screen here in the light green, you can sign up to volunteer. And depending on whether you are lower risk for COVID complications or what is traditionally called higher risk by the health authorities, then we have we can take any volunteer who's interested in helping, either by being an active buddy, doing phone calls, doing errands. So that is absolutely an amazing thing to get your help with. The second is really, we would love to get out the word, both to get more volunteers, but also to get more requests. We want to be helping where the help is needed. And so there are a few ways you can do that. The second is you can always direct people to berkeleymutualaid.org, which is where we are, and anyone who needs help can click on that light blue section. You can also flyer in your community. If you whatever neighborhood you live in, we have flyering, which Dave is showing where that is. You can download the PDFs, print them. We obviously ask that you do it in a socially distant, safe way, wearing your mask, and you'll see all the safety protocols here that we ask you to follow if you are up for doing this. But this is really an incredibly helpful way to get the word out. And particularly, as we all know, your neighborhood, I know my neighborhood better than someone else could. And so you may know actually the neighbors that could particularly benefit from this, or that would particularly be interested in volunteering. So sharing our website, putting out flyers would be incredibly helpful. I would encourage anyone who's interested in signing up for our newsletter, which is at the bottom of our website. You can sign up. You enter your email. One highlight I'll give, we obviously have a weekly newsletter, but we're also aiming to have a weekly call to action that has one specific thing you could try to do that week to help. And so, for example, the Meals on Wheels call for donations was a call to action that went out. Flyering, I think, is going to be our next call to action. But it's something concrete that you can do that as a one-off ask. And then lastly, we do try to keep a running list of resources available on our website. So we are sharing the vetted resources that we find. We're trying not to have this list be too long, because we know those lists can be really overwhelming, especially if you're already in an overwhelming situation. But this is our list of financial help, food assistance, and we also have, you can submit resources if you have ideas as well. I think that it's probably my 5 minutes. So would love to hear questions, but in general, I think probably like many of you, we've just seen an incredible outpouring of community, solidarity, support. People are really eager to help and connect with one another, and that's pretty incredible. So thank you to all of you.
Thank you so much, Helen. And if you have any questions specifically for Helen, having to do with Berkeley Mutual Aid, feel free to go ahead and ask it in the chat room. I don't think I see anything coming up right now.
There is something coming in now from Keith May. I'm also going to take this opportunity while that's happening is to remind people who are coming in, because we do have some new people. Number one, if you're looking for the chat feature to post a question or a comment, you can also get the meeting notes. I'm going to be intermittently putting the link in for meeting notes. Hover over the bottom of your Zoom screen. There is a chat button, and you select that, and it will pop up a window. And go ahead and ask your question, make your comment, and we'll go ahead and make sure that the question is asked. It looks like we do have a question of, Helen, do you keep track of numbers of the type of work that is being done? And thank you from Chief May. Very good work, he says. I also am monitoring the email address for info@bdpnnetwork.org. We have gotten a couple questions about some technical issues. And also, one last housekeeping thing. We are not using the hand-raised feature of Zoom for the first part of the portion tonight, first portion of the presentation. Just use chat, please, and thank you. Oh, you're muted. Just a second. Apologies. Go ahead, Helen.
Great, thank you. Yeah, Keith, thank you for the question. We do, we keep track of all of the teams we're pairing and the type of request that was initially made. And then generally, if that request changes, we have, if it requires a new volunteer, we'd have data on that. So I would say we definitely know all of the types of need that people are asking for, and then the types of support that volunteers are offering. And that generally falls into the 4 categories. Originally, we had free forms, so people could just tell us anything they could offer and anything they needed. And we started noticing they really fell into the 4 categories that I identified in the call. So kind of the errands, the desire to connect with someone else, the desire for social assistance or financial assistance. And so that's when we actually started saying, okay, those are the 4. And so we still have free forms so people can say specifics about what they need, but we do keep a record of all of that. And when we get more information about those needs changing, we do track that. We also, I should mention, do follow up with our volunteers and to some extent with the requesters as well, to get a sense of how it's going. Is this working? What's not working? Can we continue to make it better? And I think that has definitely helped us get feedback that we've worked to implement. Keith, did that get your question?
He may be muted at this point. Let me ask, point out one thing and ask something of Helen, which is, and a really important part of Berkeley Mutual Aid is the recognition that not everyone has access to the internet. So there is a phone number, a Google Voice number that you can call. And I'm trying to remember what it is, 510 519 6770. I will get it from the website and put it here. But we realize that that's, flyering is super important. Obviously, getting the word out to people who might not have access to the social networks that we tend to try to put the word out on. But having that phone number is super critical as well, so that anybody who has access at least to a telephone can ask for help or provide it that way. So that's a super important part of it. And the other thing that Gradiva, cousin, who's very involved in this process as well, pointed out that although we are not government officials by any means, but we try to stay in touch. So for instance, we have a weekly meeting with someone through Berkeley Department of Health and kind of connect and find out, they're always wanting to check in, are there cases that we need support on? How can we support them, and all that kind of stuff. Okay, I'm gonna switch back to the website just so I can get the phone number.
Yeah, and I also added it in the chat for anyone who's in there as well. Okay. And yeah, I would really emphasize, obviously, where it makes sense, we pair people within neighborhoods because that makes errands a lot easier. But we are really trying to bring people together across all the many forms of difference. And so where we're able to, we will pair people across neighborhoods or across cities, if that makes sense, to try to build our community here in the East Bay.
Helen, we have a question about a couple of questions. Number one, are you connected with the Berkeley Food Network? They have a pantry. It's open for walk-ups at specific times. Maybe who can't make it to the pantry could have someone make the trip for them. We also have a question about social needs, including pets. Someone needs to put to home a kitty. And so we can either address those now, or we can get those into some answers for these folks and send them a message after the fact.
Yeah, absolutely. So I would say on the social needs, we do try to focus on where the need is most urgent. And so there is some triaging that we do even on our day-to-day work. Where we get requests that fall out of kind of our standard types of requests, we try to include that in our newsletter if it makes sense. So I think, Mike, to your question, that would be something we're not focused on that, and that's not our mission, but where, if it makes sense, we could include a call like that in the newsletter and say, here are kind of the miscellaneous asks we're getting. If this makes sense, please connect with that person. That's kind of how we're currently handling that. But that can become quite a broad range. And so we are really focusing our mutual aid on kind of the core needs, which is challenging, but that just helps us meet the most urgent needs around like needing food and needing financial assistance. And I will mention, we've had a little bit of trickiness around pets and social distance. So there are people who, of course, they need someone to help walk their dog or come into their home and care for them. And we've generally determined we also need to keep our volunteers safe. And we can't extend ourselves to that kind of like in-home support or pet support that goes against social distancing. On the Berkeley Food Network, we have reached out to them, and we are generally reaching out to the established groups in the community to understand what their needs are and figure out if we can help. Obviously, again, sometimes we can't help, or it just doesn't make sense as the volunteer core that we have. But like I mentioned with Meals on Wheels, we had an offer of like, hey, we have volunteers, can they help? And they said, actually, we don't need volunteer labor. We need food and we need toilet paper. And so we said, oh, well, we could probably do that. So let's ask. And we did, and had a great response.
Okay, so I just want to clarify that what we're trying to do is show how communities come together and step up in times of crisis like this. And the Berkeley Mutual Aid is an example of setting up an infrastructure to make that possible, even where parts of the community that aren't familiar with each other. But there are lots of neighborhoods that are doing that on their own. Like they already had some kind of connection and they really put that into action. And CERT groups are a good example of groups that have been sort of preparing for not necessarily a pandemic, but knowing that they were going to step up when it's needed. And so I'd like to see if we can get Bill Swartz unmuted so that he can talk about the Housedown Neighborhood Group. And I'm going there next, partly because they're kind of an unusual group as well, because it's Berkeley Mutual Aid is sort of Berkeley and beyond even, and there are lots of neighborhood groups doing it. And Halcyon is a pretty large neighborhood group, and what they're doing is pretty unique. So why don't you dive into it, Bill?
All right, well, thank you very much, and it's sort of an honor to speak to all of you. So what I'm going to do, I promise not to exceed my 5 minutes, is quickly take you through the history, why are we doing this, then do a little sort of behind the scenes, how do we do it, how does it operate. I just want to really bluntly, because I think everyone's going to be interested, lay out what I see as some of our successes and then some of our disappointments, what we're doing next, and then sort of leave it at that. So again, I'm Bill. Thank you for having me. For those of you who don't know, Halcyon is a group defined by Adeline and Telegraph, and then Ashby and Woolsey. So it is a huge, unwieldy neighborhood. It's 900 and some odd households, which has its own challenges. I've been involved with CERT here for about 3 years. The motto of CERT in the Halcyon was always save lives, meet neighbors, build community. So when the pandemic arrived, it just seemed like an obvious way to take that kind of impulse and translate it. Outreach has always been our first step and our biggest concern, because as you mentioned, the people most in need are the people who are almost definitionally going to be hardest to reach. And so we did a couple of different things. As you say, we made sure that we're contactable by text, by phone, and then as well as by email and by web form. But more importantly, very early on, we decided to do a postcard mailing. We bought a mailing list from a commercial vendor, which was somewhat expensive. We spent about $700 for about 900 houses. And I don't think it was 100% effective, but I think it worked pretty well. And it was a way, without using a lot of time and a lot of volunteer labor, to get people who you might not get, including sort of, live-in units in backyards and auxiliary dwellings, and lots of places that have traditionally been skipped by flyer distribution. Our goal has always been, our initial goal was simply to match need and demand. We started with the basics, and by the basics I mean putting together teams to pick up medications, pick up teams to put together groceries. That's where we started. Very soon afterwards, we added check-in, a regular call, how are you doing? And then after that, we decided to expand the check-in concept, what we call chat buddies, which was something we designed in collaboration with Susan Snyder, who I'm sure many of you know. And the idea was not to provide any kind of psychotherapy or social or psychological services, but simply to have a friend in the neighborhood you could talk to. And Susan put together an orientation for volunteers who are interested in that. And then once they'd gone through the orientation, we sort of designated them as chat buddies. And I want to get back to that in a minute. I'm going to circle back to that. In terms of technically how it works, for those of you who are interested, it's really, really straightforward. We use Google Forms, which dumps all the information into Google Sheets. And then we wrote a bunch of macros to help us keep track of who's been matched, who hasn't been matched, and what streets people live on. It's not perfect. It's certainly not ready for prime time, but it's a viable system. If anyone's interested, I'm more than willing to share, although again, it's hardly professional. It's kind of a mostly working clunker. If we ever expanded much more, I'd probably want to move away from Google Sheets. And again, that's a conversation I'm happy to have separately. In terms of wins and operational pace, right now we have about 85 volunteers, and we're putting together sort of one team a day. We have also, and I should have mentioned a second ago, sort of blundered into mask making. There have been a lot of interest in getting masks, and we had a group of people in the neighborhood who wanted to make them. And so we're also providing, I don't know, on average, I'm going to guess 20, 30 masks a week maybe. In terms of capacity, that's a win and a loss. So at masks, we think we're probably providing about half of what our neighborhood resources can make. But in terms of team matching, we are providing a teeny fraction of what we have. Volunteers outnumber people in need. We think it's sort of 1 to 2 matches a day. We're probably operating at about 90% of what the neighborhood, 10% of what the neighborhood could do. And that's sort of a disappointment. Another disappointment has been the lack of interest in check-ins and chat buddies. Volunteers love it and want to do it. So far, a lot of people haven't shown interest. We don't know if that's sort of a marketing thing or it's just not a priority, but it's something we're thinking about. And then my last point would be next steps. Because we do have this sort of abundance of capacity, we're looking at doing a little bit more marketing, talking to our city councilman, maybe doing another postcard mailing, doing a media push. And I do have a pretty good list of local media. Also looking at expanding our neighborhood and going beyond just the Halcyon. We did a poll of volunteers, and 30% love the idea, 10% oppose the idea, and the rest are neutral. And I'd also add for staffing, this whole thing has been shockingly lean. There's really only 2 of us who are doing most of the work. And now we also have sort of a core of what I call super volunteers who are spreading the word and who take a lot of jobs. But administratively, the whole thing is really pretty much 2 people. And that's kind of it for me.
Can you let us know how people can contact you? And I'll put it on.
Sorry. halcyonhelp.com. And if you don't mind, if people are asking questions, you can just get the browser up to that too.
Sure. So, well, first of all, you have a couple of go to, yay, Halcyon group. Helen Marks from Berkeley Mutual Aid said that they've been using Google Sheets as well. So happy to start a discussion with you about what does and what doesn't work. Looks like Carrie from CERT could help organize adjacent groups, Bill.
Okay, great.
That's in chat.
Yeah.
And just a reminder, we'll just do one housekeeping thing for those of us who joined late. We are using the chat feature of Zoom, which is in the bottom. If you hover, you'll get a chat window. Go ahead and ask questions, post comments. You can see communication going back and forth. I'll be posting the meeting notes for the evening through there. We are not using hand-raising feature, at least the first part of the presentation tonight. Thank you. Dave, take it away.
I'm actually going to take things a little bit out of order. I know Kate Harrison was hoping to talk about some stuff, and I am going to get to her right away. But in keeping with sort of neighborhood communities supporting each other, I'm hoping that Peter Samus can be unmuted so he can step up and talk about the kind of connections and communications that's happening in his neighborhood at 600 Nielsen and 1500 Portland. Thanks, Peter.
Yep, Peter, you're unmuted.
Okay, can you guys hear me fine?
Yep.
Yeah.
Yeah, I'm going to share my screen at some point, so I hope that's possible too. I don't need it yet, but I will in a minute. About in mid-March, we started out with a query to the block, and did anybody need help or know neighbors who needed help? Or did it was basically formatted after what David circulated from Richmond, where you had 3 different options. Do you need help? Do you want to help? Or do you want us not to bother you again? And so many people came back and said, we'd love to help. No one said they needed help, and the neighbors who didn't respond apparently didn't need help, judging from what their neighbors reported about them. So we had the volunteers, and after a while we thought, what are we going to do? We decided to bring people together to build the block network and preparedness. And so we meet every Saturday morning on Zoom. Whoever wants to attend comes. We've had attendance has fluctuated, but we've had as many as 12 or 14, and sometimes fewer. We have neighbors on our block who have skills, specific skills. There's a meditation teacher. There's a mindful self-compassion teacher. They've led us in meditations in times of stress, mindful self-compassion exercises that we could do. We could go into a breakout room. Otherwise, we're building beyond that. We're just building relationships with each other from living room to living room. We've been doing mask making for an effort that was coordinated by a couple of block members who had destinations for masks, and numerous block members came together to work on them, came together virtually, I should say, leaving supplies on each other's porches and ringing doorbells and things like that. And no one is, at this point, no one is sick, but many are connected. I think I do want to share a screen now, just get a sense of, so this is what the Zoom meeting looks like when we're all at it. And this was at a wonderful meeting where you might see James Barras, who led a meditation, his wife Jane, who led the mindful self-compassion exercise. Everybody checks in, and people sometimes are just sharing what's keeping them sane, and suggestions for trails or hikes that are safe, or streaming or movies that they've discovered. And finally, and in this particular meeting, the person over here, Tavi, played a ukulele solo for a song, and someone else played, a 12-year-old played baritone sax. So that was fabulous. And then finally, there's one other thing I want to share, which is these were, can you see this? The daily quarantine questions. Is that being shared?
No.
Okay, 1 second. Let me go back to share screen again, and I'll pick a different file. Let me see if I can find it. New share. Here. These I think have been helpful for some. If I can, is it up or not? Let's see. Well, here we go. This ought to work. Is that not coming up? I'm going to close this then. Stop share and start a new share. I'm just going to try a new share. I'm trying to move from one to the next quickly. It's not coming up, is it?
There it is.
Daily quarantine questions?
Yes. Yeah, so these are just very simple questions that James came up with. What am I grateful for today? Who am I checking in on or connecting with today? What expectations of normal am I letting go of today? How am I getting outside today? How am I moving my body today? And what beauty am I either creating, cultivating, or inviting in today? So this is just an effort to keep us all sane while we're moving through this. And meanwhile, we're keeping connected and available if people need help. I think that's all I need to say for now. Thanks.
Thank you, Peter. That was really nice. And that's a great connection for something else that we're going to be having on the agenda a little bit later on, having to do with sort of, staying healthy mentally, emotionally, as well as physically. So we can talk about that later. So let me get back to sharing the agenda. Kate Harrison, are you on the Zoom call, and can we get her unmuted? Kate Harrison is a Berkeley City Council person and wanted to talk a little bit about, I've got Mass for the Homeless here, I'm going to change it to Houseless, and for seniors, if if you can go ahead and dive into what you were hoping to share, Kate.
Kate, you should be unmuted. Do I have you unmuted? Or do we have more than one Kate?
Kate Harrison, I don't know if it's.
I am not seeing, I thought Kate, I saw Kate earlier, but I don't see her there now. There is a Kate, but I don't, sorry.
Okay, well, why don't we go ahead, we'll table that for now. If Kate comes, Kate, go ahead and step up into the chat room and let us know that you're here, and we'll try to get back to you. And we'll go ahead and move on, if that's okay. Which goes into the staying healthy physically and mentally and emotionally. I've got 10 minutes allotted for this. I'm not sure how much time we really need to share, talk about this. I think, you know, one of the things that's really, we realized was super important with the mutual aid network was making sure that we had safety protocols that were constantly being updated, right? Because we're seeing new information come out about what really is the best approach to take around safety protocols. So we decided, instead of trying to keep the website updated, we just had it as a Google Doc so that we could really connect to that right away. Here, let me just show you where that is if I can. Unfortunately, my Zoom controls are getting in the way. So down here we have our safety protocols, and they just go directly to a Google Doc, which we update all the time, and it's pretty lengthy. Oh no, maybe we streamlined it a little bit. But it's a super important part. If we're asking people to volunteer, we want to make sure that they're staying safe. So that's really important. And then of course, I would love to hear what people are sharing about or can share about exercise, because my exercise regimen has totally gone out the window. I love swimming, and that's obviously a difficult thing to do now. So if people want to share that information in the chat, that would be great. We've, I think, had a great example from Peter and his neighborhood about what they're doing to make sure that they're staying sort of mentally and emotionally engaged and checking in with each other. You know, BDPNN is really all about community. You know, we always talk about how in a disaster, the best thing that you can do to prepare is to get to know your neighbor. And I think we're seeing this now. It's an odd one with the pandemic because of the physical distancing, but that I hate the term social distancing, because I think it's we're starting to realize how important it is to remain socially connected for our own individual sanity, but also for the well-being of a whole community. You know, BDPNN has had these presentations in the past about mental health issues around disasters. There can be a lot of trauma involved. In some ways, this is, you know, being in a pandemic is really different from those kinds of things, but we really need to pay attention to the long-term mental health. Those of us who are out of work, those of us who are super isolated because we live alone, it's really important to try to stay connected. And I think we've heard some examples of how people can really connect. I also want to go ahead and share in the Berkeley Mutual Aid, you know, there's a whole section under our additional resources page here having to do with mental health. And my 27-year-old just shared this one with me today, which I love, and I'll share this in the chat as well if I can. But there's a wonderful thing called Mad Maps for the Pandemic, and it's just a way for people to kind of check in with themselves. And this is not too far removed from what Peter's quarantine daily quarantine questions is about. I think it's really important to sort of check in with ourselves. Otherwise, you can kind of get lost, especially when you're feeling like this shelter in place. You know, we keep getting word that it's being extended, which is definitely the right thing to do, but it can feel super overwhelming when you feel like, is this going to go on forever? There doesn't seem to be any way that I can determine when it's going to end. And that can be super overwhelming. And so having these kind of check-ins with ourselves, as well as with the people that we live with and our neighbors, is super important. I did want to share that also in my neighborhood, we do get together for a 6 o'clock sing-along. You know, this sort of came about from Italy, where they would sing out on the balconies, and I think that can be a really wonderful connection. Obviously, following those, you know, safety protocols of making sure that you're not too close to each other, you're wearing masks, which can be kind of hard for singing. But our neighborhood, even sometimes it's just 4 of us out there singing. We're kind of out there at 6 o'clock, and it brings sort of normalcy to something that otherwise just feels super surreal. I also want to talk about, you know, when we're all in kind of large-scale emergency mode, it can feel like we just need to do the essential things. But it's really important that we understand that we as human beings need art. We need humor. We need literature. We need, you know, everyone talks about the internet, like, was it really built for kitten videos? Yeah, actually, I think it was really built for kitten videos during a pandemic. Having, sharing humor in a time that's going to be stressful for a long period of time, I think is really important. I think a lot of people, if you're on social media, you see that museums started this wonderful project where they would take famous pieces of artwork and people would try to recreate them, posing in them in their homes. And I love the creativity that people come up with that. And I think sharing that kind of creativity is super important to not only the sanity of the people who are doing the creative artwork, but also those people who they share it with. I love how much people are sharing that kind of stuff. I also did want to share that the city of Berkeley's health department was very good, and they have a press release out right now. Is this it? No, this is not it. Sorry, I think I went to the wrong one. Excuse me. City of Berkeley, protect your mental health. Here it is. This is on their website, and I'll try to put this into the document as well. But it's linked on that additional resources page from the Berkeley Mutual Aid organization. And again, you know, having taking care of yourself is really how we're going to kind of get through this in the long run. I think a lot of us feel like, oh, I'm doing okay mentally and emotionally, but the long term, it's important to do sort of preventative care and not just wait until all of a sudden we're really struggling with something that kind of caught us off guard. Like doing meditation, doing mindfulness exercises before you start feeling overwhelmed is super important. And then, of course, they also have resources for community crisis and peer support. So these are some good resources that the City of Berkeley shared with us, and is also on that resources page. I'm not going to go too much into it. I seem to have temporarily lost my chat box, so I don't know if there are questions that anybody has or anything that anybody wants to share. Lynn, is that something that you might? There we go.
Well, there's lots of people sharing all kinds of things right now, which is great. There's a huge, a pretty big group of people who are sending things back and forth about things that you can do.
Excellent. And we will be saving, by the way, this chat. So it's not just going to be a video recording, but we are actually saving the chat as well.
Sure.
And so rather than spending too much time, because I think some of these are great, great suggestions. So we'll share that and add that to our link.
There was a request for you to zoom in a little bit closer on your screen for the agenda, that's all.
Oops. Okay. And then if it's okay, I'm going to go ahead and move on to the next phase. Let's do a little time check. Since we just had a mental health moment, we've been doing this now for 50 minutes. Feel free to stand up, stretch. You can turn off your video. Do a little deep breathing, use Zoom calls. Again, I get a little bit caught off guard. I don't really realize how stressful, because you're always on, right? You're always on, but you also don't have the social cues. And whatever social cues that you are getting from muted people are coming in slightly after, slightly delayed. So let's take care of ourselves in this meeting as well as throughout this crisis. Okay, so one of the things that I think is important for us to talk about is disaster prep during a pandemic, because we've seen it happen with the tornadoes on the East Coast and in the Midwest, and it can happen here. You know, California has a long history of disasters of many kinds. But one of the things that's been amazing about this pandemic is that we still have the ability to communicate with each other, even though we can't go up and hug each other. We can connect, and we have lots of ways to do that. So what happens when we have an emergency where that is taken away from us, and how do we kind of connect with that? So the good news is we have, from the Berkeley Fire Department, we have Chief Keith May, who's going to talk a little bit about that. But before I have him start talking, I just want to say that this pandemic is an opportunity for us to kind of prepare for a disaster. We are now able to sort of take the time and connect with our neighbors. We're experiencing a large-scale emergency right now, and we understand how important it is for us to be there for each other, even if we have to stay 6 feet apart and wear masks. We can be there for each other. And I know that Charlotte, who's on our board, and I, once this started, we immediately, you know, we have a pretty connected neighborhood, but we really made this concerted effort, and so did lots of our neighbors, to make sure that every person was accounted for. And I think we have that opportunity to do that now. So in preparing for any other kind of disasters during a pandemic, I think one of the things that we could be doing to prepare for that right now is to be making sure that we're connecting with our neighbors. Okay, so Keith, do you want to step up?
Hi, good evening, everybody.
Chief, you are unmuted.
Okay, thank you, and good evening, everybody.
Good evening, Keith.
Well, first of all, I want to thank those who have done presentations. You know, it's hard to see what's happening in the community when we're trapped inside of an emergency operations center for 12 plus hours a day. And so even I know our community branch, I'll introduce myself here, but our community branch does reach out to a lot of the different organizations that are what I call groundbreaking or in the weeds, or grassroots. So my name is Keith May, for those who don't know, and I'll say my day job or normal job is that I am the Assistant Chief of Special Operations for the Berkeley Fire Department. And that my main job with that is running the division of Office of Emergency Services. So there's a lot to go in that, especially during these times of disasters. So for this particular pandemic, we actually opened our Emergency Operations Center in January, late January, and been running first at a virtual or a monitoring mode initially for the first week or two, and then upgraded to partial. And then once we realized the brevity, well before the state started doing some of their protocols, we went into full operation, which a lot of our counterparts were asking why, but when we started producing the work that has been happening, I think they understood. So we've had good partnerships, not only with our community members and organizations, but also, you know, good support of the city council. And our operational area, which is the Alameda County operation area, and also the state. We're in meetings, a lot of virtual, a lot of phone conferences with our partners from Alameda County, state, Cal State OES, and when it goes up to the feds as well. So so for this pandemic, I am inside the Emergency Operations Center, I am the Operations Section Chief. So anything that has to do with operations kind of is our department, or is our section. It got so big, I mean, we have probably 70 people working right now in the operations section that I had to get help. So I have a section branch coordinator as well. And then each of those different branches have really top-notch professional people running those branches. So a lot of our city resources have been directed to emergency response and maintenance of all the essential city services. So we still have to run our law enforcement branch, still our fire branch, all our garbage runs, all the essential services, public works, even the clerk's office is still running. So we look at each one as being, are they essential for this response? And if so, they're at work or working in the Emergency Operations Center. And then as we dove further into the pandemic, we realized that social distancing and social or physical distancing needed to apply to even our essential services. And this is probably the first time a lot of us have worked remote from home. So imagine a typical emergency operations center. We could have, in the main room, we could have 30 people. And right now we have 6. So we've decreased our footprint in the city tremendously. So it's a lot of coordination that's going on, and Zoom, Skype, and good old phone calls still remain prevalent for us. So one of the things that we started to look at, obviously because of my normal job, I'm well aware of fire season. And what comes along with fire season is the weather and the PSPS, or the public safety power shutoffs. And so those things don't get to take a back seat. They may shift gears or decrease the gas pedal a little bit, but we still have to plan for that. So not only are we responding to the pandemic and social distancing and testing and epidemiology, just everything surrounding housing our unhoused. I couldn't tell you all, it would take me too long, greater than 5 minutes for sure, to tell you all the work that's being done. But aside from that, we still have to plan for, like I said, the disasters that could still creep into Berkeley. So with that in mind, the first thing we looked at was, okay, let's talk about PSPS, because the first thing that's going to hit is our wildfire season, and what do we need to keep that in the eye of PG&E and our community. So we have a lot of critical facilities that PG&E already knew of, but because we are putting up shelters, we're putting up respite sites, or critical, what I call critical and essential functions, such as the Berkeley Food Housing Network, all these places that support our essential services and our need to shelter our vulnerable population, they now become critical. So we were able to list and gather all the information for critical facilities, which are our urgent care. It might be a testing site, a mobile testing site, and those resources or those locations we shared with PG&E so they can put it on their radar as a critical facility during this pandemic. So another area we looked at is, should we have to, I know you might get a weird message because you're told to shelter in place, but should you have to evacuate, we have to have some place for you to go. So our shelters they don't look typical as they would in a non-pandemic or non-public health emergency. A shelter that might have 100 people in it, we might only be able to fit 40 because of the social distancing. There may be temperature checks done at the door, more medical staff on hand to do testing or to do quarantining. So it just looks a little bit different. There's a lot of the things that we do that are normal, but they just might look different. Yeah, so things that, Dave, you said it right at the beginning, and I thought you were going to take my whole talk away from me, but while we're at home, this is a good time, like you say, to get to know your neighbors, external, even if it's just a phone call or, wave across the fence or something. But also it's a good time to do your personal preparedness. If you're using your personal supplies, especially during the initial phase of this, where there wasn't any toilet paper in the stores or decreased amount of flour or food, this is a good time to restock those items. And I would encourage you to also now have some type of face covering inside your personal go kit, whether it's a mask or a bandana. But still, we push one of my jobs today was to write a press release for the upcoming PSPS and still encouraging people to sign up for AC Alert. And I give a big hand to the mutual aid program because they are a good source for people who are vulnerable populations or aren't getting out, can't get out there and get those supplies that they've already used up to restock for their go bags or their go kits. So things that are still happening, obviously, well, let's see. The new health order came out and it's effective on the 4th at midnight on the 4th. But I think some of the big things that changed there was for light construction, I guess. One of the things that we're pushing still is our hazardous hill inspections. So we still want people to take care of their house, their yards, their trees, anything that's dying. So it was good to see that shelter in place order was lifted just a little bit enough so that people could hire gardeners to come out and clear away brush and prepare for the wildfire season. Gardening is still good exercise. I try to do it at least one of my days off. Our debris bag program flyers went out earlier this week, so that's still moving forward. Again, our hazardous hill inspections are still moving forward. So I think I know that's a lot, and I know I may be over 5 minutes, but there is still a lot going on that I think that as long as the community still tries to prepare and do the best they can, the city is still going to be there to do our part. So questions, I suppose?
Yes, Dawn, go ahead and ask the question. I think that came up in chat.
Yeah, I think you might have already spoken to this, but as the wild grass is growing like crazy, will BFD have inspectors out checking properties that are overgrown?
Yes, for sure. That to us is an essential function of the job. During this time, a lot of our inspectors are doing other work because fire prevention and some of our other facilities or some of the other businesses, because those businesses were closed, there was a reduction in the need for them to go out. So we just transfer them into something else to do. But our hazardous hill and our inspections up in the hills are still going forward, for sure.
I think that might be the only question that's coming through chat anyway. So towards the end, we'll probably field a couple questions and you might get something in a few minutes.
Okay.
Thank you, Chief. Dave?
Okay, so going back to the agenda, obviously if we do have a power outage, one of the things that we lose that's been kind of a boon to how we respond to the current pandemic crisis is our ability to communicate through phones and that kind of thing. It may be parsed out, but communication all of a sudden is going to be, which has been really so important for how we respond to this, is going to be taken away from us. So I reached out to Jeff Lomax. I'm hoping he's unmuted now, and he's with Be Certain, and he can talk a little bit about that. He's come and presented to BDPNN before, but he's very involved in the GMRS radio program and is pretty knowledgeable about NALCO and the ham radio program as well. Jeff, do you want to step in?
Sure. Thanks very much. I could pop up a slide if you'll give me the screen, but it's going to be very quick because I really just have to first of all, thank you for organizing this event. It's very timely, and really hats off to the mutual aid group to be able to really pull something together so substantive in such a short period of time, having done organizing at this level or at even a much more modest level, I have to admit. That's just a remarkable achievement. So thank you so much for your service. What I want to just talk about very briefly, it's really to reiterate something Dave said. This is something we've set up as a disaster preparedness effort. Let me just see if I can pull this up. You cannot start screen share while other participants, somebody else is sharing.
Hold on a second. Let me fix that just a second.
Yep.
Go ahead, advanced sharing, sorry. So this. Okay, go ahead, try again.
Let me see if I can get there. All right, I think that might do it. Let's see. Well, doesn't seem to want to. Let me just talk through it. It's not that complicated. So as Dave said, I and a number of us have formed a group called Be Certain. It's a kind of a cute way of talking about what we call the Berkeley CERT and Interneighborhood Network. And what the network is the mission of the network is to use amateur, what we call GMRS radios, which are radios that have a little bit more oomph than the standard ones you get at the hardware store. And what we've dedicated the network towards is supporting neighborhood to neighborhood networking via radio. And so what that gives us is a way of really allowing both CERT teams and community members more broadly a way to communicate. What we've contributed in the way of infrastructure is what's called a radio repeater. And what the repeater allows us to do is have Berkeley-wide communication, a very stable communication platform with handheld radios that almost anywhere in the city you can communicate to anyone else at any other point in the city. And as was indicated, we've got some training modules on that, which we can share with people if you were interested or you had a group that was interested. What we do is to keep our network fit for purpose, we have actually weekly practices where we use our radios and we use the infrastructure. And again, David alluded to this, you know, one of the bright spots about sheltering in place is people who do this type of work are interested in building these types of skills. We've actually had quite a bit of time to really do some things that you tend to run out of time in normal times with because of kids, families, going out to dinner, all that. So we have a lot of members have upgraded their equipment. We're developing new protocols. Over the month of May, we're going to do a lot of extensive testing on how to talk to one another across the city. And then finally, we do a lot of collaboration. So we coordinate with a lot of the other groups that do disaster preparedness, and this gives us kind of a coordinated community response network. So I don't want to take a lot of time because it's late, but simply to say, if there's something if this is something that might be of interest to you, someone, for example, you have a CERT team in your neighborhood and you have interest, say, in communications and you'd like to learn how to communicate more broadly across the city, the website is becertain.org, and I'm sure we can get that up on the chat. You can email us, and we've got right now a roster of about 35 people, which represent about 30 CERT teams and some individuals. And again, there's some nuances here in terms of getting going with the equipment, and there's some things you have to do in terms of licensing, but it's not very difficult. And a lot of people have gotten involved by basically, we've given them equipment, they've given it a go, and if they're interested, we've got a whole way of walking people through this program so that we can, again, ultimately end up with a network of CERT teams across the city that can talk to each other in the event of an emergency. Back to you, Lynn.
So we did, a question came up about whether the transcript of the chat's going to be available. The answer is yes. We will get that out to everyone. And I also put Dave had originally, and I re-entered the Be Certain website address in the chat as well. We do have a couple questions that have come in for Keith, and I think that we'll go ahead and put those in towards the end. And then we do have two questions that just came in for you, Jeff. One is this shortwave radio?
It is what's called GMRS radio, and what GMRS radio is, think about it as those kind of the walkie-talkies you might be used to seeing at REI that look basically like a walkie-talkie. But what makes them special is you operate in an environment where you're allowed to use a bit more power than those standard off-the-shelf radios allow you to. So that's kind of the simplest explanation I can give. They're a more powerful radio than you can get at the store, but I'm sorry, the question, there was this, it was
It
asking
was,
about
was
a
it
specific,
shortwave? Was it
it's not shortwave radio, no. It's again, something a little bit different. There's a lot of different sort of gradations in amateur radio, and this happens to be, again, something a little bit different than shortwave.
We have another question. Is radio licensing a problem now?
Radio licensing is not a problem, particularly in the format we use. Again, we use a platform, what's called GMRS, and one of the advantages of that platform is you do need a license, which is good because it actually imposes discipline on the system, and in this case, discipline is good, but you don't have to take a test. You do have to pay the FCC. It's about $80, but that $80 gets you 10 years of licensing, and it licenses your entire family. So you can have your entire family licensed for a decade for $80, and you're ready to go.
Great, and there's one more question in the chat. Can the radios be purchased in bulk if a group wants to purchase them?
Yeah, it's a great question. So there has been a group in Oakland that has done exactly that. There's a number of distributors out there that are willing to work with groups. Again, they're still probably going to be a bit more expensive. You know, they're going to be on the order of sort of $50 or $60 for something that's going to be super reliable and guaranteed to work in an emergency. But there are bulk, you know, again, commercial folks that have done, that'll do bulk purchasing. And in fact, a number of groups in the region have done exactly that. And if you, like I say, get in touch with us, I'm happy to connect you up with people and talk that through.
I would like to sort of amplify that. It's a great resource for, I think Be Certain does an amazing job straddling this world of like hardcore radio people who know just an insane amount about different kinds of radios, and people like me who's like, I'd like to use a radio and I don't need to know much more. And they have an amazing amount of information, but at the same time can basically help give you information, inform you in ways that is really accessible to the average Joe like me. So thank you for that, Jeff.
Hold on, before you go further, go ahead, Dawn.
Yeah, there's one more question actually that just came in. Will you be organizing group training if there's interest?
We've done group trainings. Obviously, we've got to be a little more creative these days, and but that is definitely something that's, you know, we've done before, and we like to try to do at least a couple of times a year in one way or the other. We just need to. We were just about to arrange one at the fire station, and then we found out we couldn't use it for reasons we're all familiar with. So, but we could work something out, and would certainly be happy to organize with a local group if they had some folks that, you know, were interested. Yes.
So if someone is interested in signing up and getting a license, getting a radio and joining your group, they just have to go to the website to sign up? Website
or email. Email's even better right now, just because it's direct.
And the email address is?
It's in the chat, I think, but it's on the slide, of course, that I didn't get a chance to show. It's Be Certain, BECERTAINN @gmail.com.
Okay, thank you very much. Jeff, I did want to talk briefly about another form of communicating when we lose our power, and that is megaphones, bullhorns. And we just so happen to have, through the coordination of Chris Collender, who I don't know if he's on this or not, and our board member, Pam Grossman, but we have 5 of these bullhorns that we would love to give away to a group, to basically 5 different groups around the city, because who knows, a bullhorn may be one of the best ways to communicate in a time when we lose our power, we don't have the ability to maybe knock on a person's door. So if there are groups, why don't you go ahead and put in the chat if you would like one, and how we get a hold of you to either deliver one to you or they might be at my house in North Berkeley, and I'll have you come by and pick one up. If we get more responses, then we have bullhorns. We're just going to map it out and see what seems to be sort of the best coverage of Berkeley. I'm not sure that that's really that important, but that's probably the approach that we'll take. So that's what we're doing. And then the last thing that I have on my list before we'll go back, I don't know if Kate Harrison ever came in on the call and wants to talk about the.
She was here earlier, and then I don't see her any longer on the list.
Well, I think what she wanted to do was to talk about this amazing effort on the part of Fred Dodsworth, who is doing an amazing job, he and his wife, I believe, coordinating an effort for people to make masks, and then he is coordinating the distribution of those to people in homeless communities, and also to seniors who are kind of homebound right now. So if you are interested in that, go ahead and email info@bdpnnnetwork.org. And we'll also try to get it up on that Berkeley Mutual Aid resource page as a way that you can contribute. So I know a lot of people are making masks. There are a lot of people who are also selling masks, which I want to just say is a great thing. There are people who are out of work and are stepping up to sort of supplement their own income at a time when they're really struggling. And I think that's perfectly legitimate. And if you can support those people by buying them, kudos to you. I also wanted to say that on this Google Doc, there is, we got a grant from through Alameda County, but ultimately the state of California, on preparing for disasters. And we have this 4-step program that you can download from the website, which is basically finding your trusted allies and sharing your plan, prioritizing your health needs and creating a list, create your own emergency supply kits, and plan how and when to evacuate. And then this does not reside on the website. This is something that you download and can print out and put in your emergency kit. I hope people will do that. Every time somebody downloads that, we get a little bit of money that we can put towards our Go Kit program. So I'll share that, and hopefully people can click on that. Then we have sort of on the agenda as sort of a general Q&A as time allows. We are started at 7. We're about an hour and 20 minutes into this. I'm certainly feeling fatigue, but I'm gonna stand up and stretch. And if people want to basically ask questions, we can even try unmuting them. I'll let my co-host decide whether that's crazy or not. And then maybe at the very end, I would love to do like an unmute, and then we can all just kind of do like the 8 o'clock whoop or something and just kind of support each other. I would be up for that. That's unplanned, but I think that could be really good.
So what I would suggest is that we did get a couple questions in for Chief May, and before we open it up, I'd like to get those asked. So, and actually they're both the same essentially. What are the protocols if we have an earthquake and have to deal with everything that comes along with that, which and especially requires close teamwork like search and rescue? So Chief May, I'm going to unmute you for just a moment. In just a moment, I need to find you again. Hold on. There you go. You should be unmuted in about 5 seconds.
Okay, thank you. Yeah, I did see those questions, and I was just trying to quickly write them down as they popped up. Yeah, the earthquake. Now it's a.
And fire evacuation apparently.
Okay, let's do the earthquake first because I don't see the fire evacuation.
That just came in.
Okay, earthquakes. If I think the question had to do with search and rescue protocols, that is what we determine as is essential. So it's one of those things, kind of when I teach CPR classes, I tell people if you come across a stranger on your walk, are you going to do CPR, are you going to do mouth-to-mouth or just hand compressions? Make that choice before the event. So search and rescue definitely is an essential service. I would take steps to protect yourself, obviously. you know, earthquake, if you can grab your mask out and go to work, then do so. Maybe grab an extra one, put in your pocket in case there is the person that you're rescuing, you can put one on them as well. And put them off in a triage area, someplace that's safe, and then continue on.
Okay, so I would say that unless there's something different for fire evacuation, it sounds like it's all about personal safety there as well.
Yeah, fire evacuations. First of all, you know, we are in a shelter in place order. But if you're not signed up for ACO Alert, please do so. But one of our priorities is to get a message to everyone, especially if you need to evacuate. And we would hope you would listen to that and adhere to it, and then get moving. You know, if there's a fire coming over the hill, this is just regular wildfire sense, is don't wait to be told to leave. If you feel threatened in any way, definitely leave. Some of the signs of a wildfire season is here, obviously, is red flag days. Starting last year, we put up flags on all the city buildings, red flags, and all the fire stations. We also send out ACO alerts. I hope you're not getting ACO alert fatigue, but that's something that is just the time that we live in, unfortunately. So for evacuations, listen to ACO alert. They will tell you what to do, where to go, which way to go, and who's affected. Yeah, okay. We're still working, pushing for the outdoor warning systems. I think they may, you know, there wasn't money found in the budget to do it this last year, and so they're trying to get creative. I know the council is trying to be creative on a survey that's going to come out and maybe wrap it into an emergency preparedness group for a ballot measure, but we'll see. I don't have much for them.
Okay. So we have a couple of other questions. Two of them are related. And it's about possible remote classes for disaster prep. So the CERT classes, one was about offering or putting the pandemic class online, as well as other disaster prep courses on Zoom or other means.
Yeah, I think that's a great idea. And I was just writing to Carrie that I think we're in this for the long haul to some extent. We may be a couple of years completely removed from this still, but I think that's a great idea. I know let's see, there was one CERT related as far as the CERT members getting involved. We are waiting for some guidelines from the state on that and trying to see how that will work for our CERT group, if that's something they want to do. I think the Berkeley Mutual Aid is already doing a lot of that, and the Halcyon group, and also the Nielsen group. But I think putting it online, there is some that we can do online, some has to be hands-on, but I'm open to suggestions and bandwidth. All of our personnel are really strapped right now in the Emergency Operations Center, but for those of you, I know who you are, that good at writing up programs and putting them on, we would welcome the idea for sure.
Yeah. And regarding resources, a question came in regarding the cash supplies for CERT groups who have already been approved last year. Will you still be able to put those together?
We have them waiting in the warehouse. It did not fall under the, we were not given permission to go do those because of the social distancing. But as it starts to lift, we have 10 CERT caches waiting in the warehouse, ready to be delivered. But also it's our personnel. But as we have mobilized all these other city resources, that might be something we could get going relatively quick once the shelter-in-place order is lifted a little bit more than what it is currently.
Okay.
And with that, thank you for all those who, I think when we started this program, the CERT cache program in 2008, there were a lot more masks given to those CERT cache groups. And some of those cache groups turned them in to assist with the emergency response personnel and first responders. So I appreciate that. And when this is all over, give us that request back and we'll hopefully be able to restock you to what you were, or at least to what we're given now.
Okay, great. So Dave, we've gone through the questions now for Chief May. I'm going to mute you again, Chief, unless we get more questions. And then we can go ahead and figure out how to get some questions asked in the couple minutes we have left.
Yeah, and I just want to confirm, I think there's some issue, and I feel badly about this, that some people may have wanted to join and couldn't see the password, which is 4911, but and I think that may have been the reason why Kate Harrison didn't join. On the off chance that she's joined, is she?
I'm not seeing her. I see a Kate, but I thought I saw Kate Harrison earlier. Okay.
I think I conveyed what she really wanted to do, was sort of call for volunteers of people making masks and joining the effort. So, yeah. Now I do see one more question for Chief May. Did somebody already ask us about using our cached masks that are old, as in expired? Do you want to unmute him too?
He is unmuted. Go ahead.
Okay, it looks like I tried to respond back, but I might have gone to someone's private chat. So yes, we will use whatever masks are given. We do put them priority of, we have the LRSS, all these mnemonics are in my head, but it's our location, receiving, storage, and area that we collect donations, collect supplies. For first responders who are going out to interact with someone with positive COVID, we give them the mask that will keep them safe. And those are not expired masks. Those ones that are the N95s, there are a certain number on that N95. However, if there is an expired mask and our other essential services are in the area, like maybe they're picking up trash near an infected area or anything, we can give them those masks to at least offer some low acuity level of protection. So we will accept all masks, yes.
Okay, excellent. Thank you. So, go ahead, Dave.
I don't have a lot to say. We're just going to kind of open it up to Q&A if people have questions in the chat. We're right at 90 minutes, which is kind of what we're kind of hoping to keep it to. We can, the nice thing is it's relatively easy to hold another meeting if we feel like we didn't cover everything that we wanted to. Rather than going on for hours and hours in one night, we can hold another one. We don't have to pay rental at the church, which is usually what we have to do. Actually, they give it to us for free, but there is some payment that goes on in terms of the sound system. So I don't think there are any questions.
I don't think so. We did have somebody who wrote in much earlier to say that there is another resource that they could share. It's in concert with Food Justice and Access Champions in the East Bay. It's bayareafood.info, targeting those who have the ability to make better decisions around food, purchasing, sourcing, advocacy, giving in a way that centers the needs for those who are even more vulnerable during shelter in place. So again, that's bayareafood.info. I will go ahead, and this is in the chat transcript, but I said that I would go ahead and mention it during our call tonight if we could.
Okay, and I'll put it in the notes, and we'll also vet it and put it in the resources page of the Berkeley Mutual Aid Network as well.
Okay.
I think at this point, is there any way to global unmute, and we can all just give a round of applause to all the
Yep, all participants are unmuted.
All the presenters.
Thank you so much.
Thank you, and we'll try to do more of this.
So keep tuned. We're going to do more. Thank you, everyone.
Thank you.
Thanks, everyone. Good night.
Fantastic.
Stay safe.
First of several.
Hang in there.
See you, everybody.
Bye.
Bye. Thank you again.
Good night.
Bye.
Good night.
Meeting. Man.
I'm trying to leave, but it won't let me.
That's okay. I'll get everybody gone in just a few minutes.
Over to the right. Yeah.
There's a leave meeting in the lower right.
Yes, that's
corner.
correct.
Yeah, it always does it when I'm on my phone.
Oh, yes, exactly.
You can stay for the after party if you want.
Yeah. Cheers.
Cheers.
No, Larry, you
Anyway.
could
I'll be the last one off.
you
Okay.
could take me off.
Okay.
Thank you.
It's Carrie.
Thanks, Carrie.
Bye
Thank
bye.
you.
Thanks.
Bye-bye.
Bye.